Hello applicants, welcome to the virtual tour for the Department of Surgery at New York Presbyterian Hospital, Weill Cornell Medical Center. My name is Jessica Thiesmeyer and I'm a PGY5. I've completed 3 years of clinical training and am currently in my second year of my research fellowship. First of all, let me just say how sorry I am that we're meeting under these circumstances. Usually we would have a really nice dinner for you guys and we get to know each other in a more relaxed environment. You'll just have to take my word for it that all of the Cornell residents show up. Hopefully in the future we'll get to meet in person, but until then I'll speak on behalf of my fellow co-residents. Just a little about me. I went to Cornell University as an undergraduate and UPenn for medical school. I'm from a small town in New York you've never heard of, and I'm the first doctor in my family. Weill Cornell is of course a top program with respect to patient care and research. But I was specifically drawn to this program because of the friendliness of the residents that I met and of course because of the city itself. 7 years is a long time and residency is harder than you think, so it really helps to love the people that you train with and the city you live in. Cornell residents hang out with each other all of the time, and my co-residents are my best friends here. Most of us actually live within a few blocks of each other within the subsidized hospital housing. 2 out of the 3 buildings have tunnels you can take to the hospital, and I have to tell you that the 4-minute commute is a game changer when you have our early mornings or have to go in late at night for an emergency. Never any traffic to sit in, and I don't even have to go outside if it's raining. Our Res Life social chairs schedule lots of events over the course of the year too, like our annual General Surgery versus Plastic Surgery football game, which we won last year, by the way, 4th of July barbecue, Halloween costume party, post-ab-site brunch, those random happy hours, and all sorts of other things. And no matter what time you leave the hospital, it's New York, and everything is still open. Let me talk to you a little bit more specifically about what surgical training at Cornell is like. During your first 3 years of residency, you'll become competent with respect to the clinical management of patients. By the end of your intern year, you'll be able to take care of floor level and step-down patients. Most of second year is spent learning how to take care of patients in the ICU and manage surgical consults. By third year, you'll run the surgical team, and so you'll be able to make care decisions encompassing the full breadth of patient acuity and surgical pathology. Of course, while you're learning to take care of patients, you'll also be learning how to operate with graduated autonomy. Years 3, but particularly 4 and 5, are the heaviest with respect to operative caseload. Third year is usually considered to be the most difficult because of the balance between managing the teams and the full OR schedule. However, it's also the year in which many of us feel our training really start to click, which is really satisfying. People generally go out to research after second or third year, and we never have a problem with our case numbers. Our chiefs usually far exceed their minimum case volume. We spend almost a full year of our training at our affiliated hospital, Jamaica Medical Center in Jamaica, Queens. We're the only general surgery residents who staff this hospital. Though both Cornell and Jamaica are level 1 trauma centers, as you would expect, we do see more penetrating injuries at Queens. Cornell has the burn center for the island, and so we are uniquely trained in the management of those injuries as well. At Jamaica, we take care of a very diverse and underserved patient population, which serves to nicely balance the training atmosphere of the more affluent population of the Upper East Side. Additionally, we spend time every clinical year rotating at Memorial Sloan Kettering Cancer Center. As 4s and 5s, we take the place of a fellow on service, so many residents spend additional elective time at Memorial as well. We have a brand new ambulatory surgery center across the street from the main hospital, where residents cover cases as well. Overall, the training we experience at all of these hospitals allow us to see diverse practices and disease presentations. As many of you probably know, most residents at Cornell will spend 1 to 2 years conducting research. This is a great time to make the most of living in New York, adopt new pets, and ultimately narrow your focus of interest within the broad field of surgery. I'm currently conducting research in a lab headed by Dr. Fahey, who's our chief of endocrine and minimally invasive surgery and is of course also our program director, and Dr. Zarnagar, who's our director of robotic surgery. There are funded research opportunities basically in every field of surgery between Cornell and Memorial, but people have also gone to other institutions such as Harvard or Penn in order to work with specific faculty or participate in specific programs. One of the reasons our residents match so well to fellowship is because of how productive they are during these years. We're consistently at the very top of our board pass rates as well. Our residents match to top fellowship programs covering the full range of surgical subspecialties. Within the last 2 years, our residents have all matched at one of their top choices in the fields of thoracic surgery, pediatric surgery, surg-onc, vascular, transplant, trauma, and colorectal. With respect to moonlighting, many residents moonlight as burn ICU fellows during their research time in order to maintain their clinical and procedural chops. Though traditionally this was the only moonlighting available to surgery residents at our hospital, the department is working to broaden moonlighting opportunities for the next few years. I'm often asked about material and educational support from the department. They pay for our loops, which is huge because they're really expensive. They also pay for our yearly TrueLearn subscriptions, which is the best question bank for ABSITE preparation. We receive a monthly stipend from the hospital for the cafeteria at New York Presbyterian, and Jamaica Hospital pays for us to eat at their cafeteria when we're on call. We have 1-hour educational conferences twice a week in addition to morbidity and mortality and grand rounds. This is protected time for the residents, and the department has worked hard to ensure we aren't pulled away from conference. The program is very receptive to resident input. We have faculty-led committees with resident representation in place to improve the quality of feedback and enhance our operative training. We also have the Anti-Racism Committee that was created by our department in order to combat racism, improve surgical, ethnic, and racial disparities, and create a pipeline to increase faculty and resident diversity. I can say that just in my time here, there's been a substantial increase in the proportion of female residents and residents of color, as well as an increase in the diversity of the faculty. Residents here at Cornell have a lot of resources for simulation training. The Skills Acquisition and Innovation Laboratory, or SAIL, has many helpful tools. For example, all residents complete a robotic simulation curriculum that has been developed by Dr. Zarnagar and Dr. Afana in order to attain familiarity and some level of competency before rotating on our robotic services. Junior residents are tested on their performance of basic tasks such as suturing, knot tying, laparoscopic peg transfer, intracorporeal knot tying, and vascular anastomosis yearly in the Sim Center. They then receive mentorship from senior residents with respect to how they can improve in these areas. Prior to taking the fundamentals of laparoscopic surgery and fundamentals of endoscopic surgery skills examinations, residents are given all of the opportunity to practice these tested tasks within the Sim Center any time of day at our convenience. This year, all residents were given laparoscopic trainers to take home so we can practice there at our convenience as well. Having such a comprehensive simulation center in such a convenient location enables Cornell residents to become more comfortable and capable before ever stepping into the operating room. Thank you so much for your interest in Cornell surgery. I hope this video tour was informative and helpful, and I also hope to be able to meet some of you in person in the future very soon. Good luck with all of your interviews.